This is the third installment of the KPI or Key Performance Indicators series. In the first two, we talked about front desk and revenue cycle management or billing in short. This week, we will talk about clinical KPIs. The primary focus is patients, patient care, not just treating their conditions, but caring for and about them. The word care, as you know, covers everything from listening to them, face-to-face time with them, how much time do they spend in your waiting area that can increase their level of frustration and pain. And ultimately, we want to make sure patients are not just cured, but they're happy, which can increase compliance of treatments and meds and so on. And although not necessarily our end goal, it can help increase business by getting more referrals directly or through positive reviews online and offline. Let's look at some of these KPIs. And the first one on the list for the clinical part is patient care hours. And this is really the metric of the amount of time physicians spend directly with the patient as compared to the time spent by patients on various processes, check-in, check-out, etc. And I'd suggest why not consider getting some work done before the patients come in terms of collecting some data necessary. The second one is number of patient referrals. And this can change, depending on if you're a primary care, how many come back for unrelated visits to the previous one. For specialists, it can mean how many referrals from other providers and measuring their frequency. The next one is patient transaction, which is really about efficiency, the patient interactions and transactions that are graphed over time. Of course, patient confidentiality is a no-brainer. Breaches, the number of confidential breaches should be zero. HIPAA must be maintained at all times and so on. But you should always keep an eye on it. Looking at a few others, the patient follow-up. This is one of the very important metrics that you should keep track of. But it's not just important when necessary, but do you follow up even when not necessary, just to make sure that they're okay? And the benefit, obviously, is that they tend to adhere to your treatment plans even more, and chances are that they'll feel better about it. The rate of complications very clearly is directly related to number 31 here above, which is if a follow-up is good, if you're following up with patients, chances are that you'll be able to manage complications even when you get a little hint of it, so that it doesn't get worse and they don't get out of hand. Patient adherence to your treatment plans, again, a direct correlation between patient follow-up, in my view, because it has to do with communications. How clear are you not only communicating initially with the patient, but also following up. The communication between primary care specialist and patients. And this is a very important element of patient communication, because it tells you that when you communicate with one another for patient care, that creates a better outcome in all cases. These are the clinical measures, the KPIs that you need to keep track of, and I hope this has helped you and will help you with your practice going forward.